Welcome to features of Norma lateralis. So this is the area of the Norma lateralis. The important bones you visualize are the frontal bone, the parietal bone, temporal bone, sphenoid bone, zygomatic bone, mandible, and the occipital bone. The important sutures are the coronal suture, the lambdoid suture, the parieto-temporal suture, then the frontozygomatic suture, and the temporozygomatic suture. The two important points to be noted here are, this is the point of pterion, meeting point of four important bones, that is parietal, frontal, sphenoid, and temporal. The anterior branch of the middle meningeal artery lies below this, along with the lateral sulcus of the stem of the lateral sulcus of the brain. This is the point of asterion, or the posterolateral frontanale, and this is the meeting point of the lambdoid suture, the parietomastoid, and the occipitomastoid sutures. So this is pterion and this is asterion. Now the important features on the Norma lateralis are, you have the zygomatic arch, which is formed by the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. This is the root of the zygoma, which ends as an anterior tubercle and a postglenoid tubercle. Between them we have the mandibular fossa. Behind that we find the external acoustic meatus, which is bounded anteriorly by the tympanic plate. These are the temporal lines. We have the inferior temporal line and a superior temporal line. The inferior becomes continuous with the upper border of the zygomatic arch. So this is the area which is referred to as the supramastoid crest. So beneath this triangular area represents the McEwen's triangle, beneath which the mastoid antrum lies. Now the other important features are the mastoid process and the styloid process, which is missing in this particular skull, and between the two we find the stylomastoid foramen. Now the important attachments to the Norma lateralis are, we have the attachment of the temporalis here, and the insertion is into the coronoid process of the mandible. The masseter arises at the lower border of the zygomatic arch and gets inserted into the lateral part of the ramus of the mandible. To here we receive the insertion of the lateral pterygoid. This is called as the pterygoid fovea. Attached to the mastoid process are the sternocleidomastoid, splenius capitis, longissimus capitis, and the posterior belly of digastric on the inner aspect. Attached to the styloid process, we have two ligaments and three muscles. Ligaments are stylohyoid and stylomandibular. Muscles are styloglossus, stylohyoid, and stylopharyngeus. And attached to the temporal lines, we have the attachment of the temporal fascia. Now the important areas in the Norma lateralis are the temporal fossa above the zygomatic arch. This is the region of the infratemporal fossa. We find the infratemporal muscles, vessels, and nerves. This is the pterygomaxillary fissure, and beyond this we find a fossa called as the pterygopalatine fossa between the root of the pterygoid plates and the posterior surface of the maxilla. So these are the three areas which we can encounter on the Norma lateralis: temporal fossa, infratemporal fossa, and a fossa which is not clearly visible, that is the pterygopalatine fossa. So that concludes the important features on the Norma lateralis. Thank you.